The lumbar plexus, we're just going to learn two major nerves, and then the sacral plexus, we're going to learn one nerve. So we really got three more nerves to go. So the lumbar plexus is formed by L1, L2, L3, and L4. So notice that L5 does not participate in the lumbar plexus. All right. And then parts of L4 also form the sacral plexus. So lumbar is L1 to L4, sacral plexus is L4, L5, and then S1 to S4. There's two nerves that we're going to learn from the lumbar plexus, the femoral nerve and the obturator nerve. The femoral nerve innervates your quadriceps. All right, so remember those quadriceps in your anterior thigh, the rectus femoris, and then the three vastus muscles are all controlled by the femoral nerve. And then the sensory component comes from the anterior thigh, a little bit of the medial leg and foot, and the hip and knee joint. All right, so that's the femoral nerve. The obturator nerve goes more to the inside of the thigh, the medial portion of your thigh, where you find your adductor muscles. And then it has neurons that come from the skin of the medial thigh, medial hip, and medial knee joint. So femoral nerve right here, and then it's going to go into your thigh. Obturator nerve right here, and it's going to go into the medial part of your thigh. The sacral plexus has a number of nerves. The most important one and the largest nerve of the body is called the sciatic nerve. And the sciatic nerve is actually two nerves that happen to be packaged together. And this drawing doesn't really show that, but these two nerves, when we look at the next image, we're going to see are actually held together as one nerve, and then they split apart from one another down towards the knee. So this nerve innervates your hamstrings. All right, remember your hamstrings are in the back of your thigh. And then all down the back of your leg as well. So your gastrocnemius. So pretty much everything down the back of your leg. As well as the skin down the posterior side of your leg and then down on the sole of your foot. So if we take a look at them individually, we see the obturator nerve coming from that lumbar plexus innervates the adductor muscles. So again, if this nerve gets injured, you might have a problem adducting or moving your leg in. And that has been known to happen with some troubled childbirths. So the mother can get this injury to the obturator nerve and cause a problem with the adduction of their leg. And then this is a medial view, so this is the inside of that thigh right in here. The femoral nerve, notice it innervates a lot of the skin, all right, almost the entire anterior thigh, some of the anterior leg, as well as a lot of the medial portion of the leg. And it innervates your quadriceps. So if there's damage to the femoral nerve, you might have trouble extending your knee. And then finally, the sciatic nerve, again, largest nerve in the body, extends all the way down the back of the leg, innervates your hamstring muscles and your gastrocnemius. And a lot of individuals suffer from sciatica. Sciatica can be caused by a number of things. Lower back issues in that lumbar spine. Pregnancy can cause sciatica, where you get this shooting pain down the back of your leg. These are probably my favorite pictures showing these. This is the same leg, it's just an anterior view versus a posterior view. You'll notice with the anterior view, you can see the femoral nerve going to that anterior thigh, the obturator nerve going to the medial thigh, and then the sciatic nerve coming down the posterior thigh and then splitting into tibial, which goes behind the tibia, and what's known as the common fibular nerve. So these are the two nerves that are held together as what we call the sciatic nerve. Okay, rest of this video we're going to kind of talk about some other things. So dermatomes are very interesting. So dermatomes are segments of the skin. All right, derma meaning skin, dermatome meaning segments that have basically been mapped. All right, so a lot of books will show a very similar picture, but you'll notice all these segments of your skin are labeled with precisely what spinal nerve that sensory information enters at. All right, so your skin is basically innervated by all spinal nerves except your face. Your face is innervated by one of your cranial nerves known as the trigeminal nerve. So if you get poked in the face, if you cut yourself shaving, or if you're sensing anything on your face, that's going directly into your brain using the trigeminal nerve. All the other areas of your skin, it enters using a spinal nerve. The one spinal nerve that doesn't innervate skin is C1. So no neurons from C1 come from the skin. So why is this useful? Well, if you know these dermatomes, you can use it to assess nerve function or loss of nerve function. So, for example, if someone has a nerve injury and it has blocked the sensory signals, they would have certain patterns of numbness. All right, so if maybe they can sense this L3 dermatome, but once you kind of stimulate the L4, L5, maybe they're not perceiving that. So that means that there's most likely an injury to L4, L5, or that area where those nerves enter the spinal cord. All right, so dermatomes are very useful in clinical assessment of both the spinal nerves as well as the spinal cord. So if someone has a spinal cord injury, let's say it's right here, okay, right about at T9, we could assess these dermatomes and they might be able to sense T8, but maybe not T9, all right, and maybe not T10, and maybe not T11. So that means that there might have been an injury so severe that it's blocking all the sensory signals that come from the dermatomes below T9, okay? So that's what the dermatomes are useful for. We're going to then move on to reflexes and reflex arcs. I think it's probably a good idea to start a new video here since it's somewhat a new topic. But we're talking about very quick, involuntary responses that are in place to protect you. So reflexes are all protective mechanisms. So we'll do our final video focusing on reflexes.